Welcome to another exciting edition of your favorite program, Health Affair on AIT. On the program, we'll focus on critical public health challenges, issues of women and children, with a view to finding lasting solutions. I am your host, Oshuomowa Daniels. The challenge of having multiple births in the current socio-economic situation prevailing in Nigeria has renewed discussions about the family of Mr. and Mrs. Omage Ewanle, who were delivered of 5 babies in January 2021 in Lagos State. This will be the focus of our discussion today on the program. But first, let's take you to our news segment.
We are committed to deliver our own quotas to the healthcare system. However, the government needs to make a conducive environment that will aid seamless delivery of healthcare.
After hours of deliberation by the National Executive of the Association of Resident Doctors with the Minister of Labour, an agreement was reached. The resident doctors are now back to work, and many are expecting that this will last the test of time, as it has become a recurring pattern for government to negotiate with healthcare professionals and later default on implementation.
Any moment that is the health system is broken endangers lives, sometimes in their hundreds and thousands. So what we are seeing with the recurrent strike action of doctors in the country is a bad omen.
An average doctor will work 300 hours in a month, and that is enormous, and they need to appreciate that. What they are asking for are just the basic things.
To fill the gap created in the sector by doctors who have migrated abroad for greener pastures or those that have retired from the system, there were suggestions for government to collaborate with doctors in private practice.
The private sectors of this country are the ones providing care for over 70% of the 200 million Nigerians across this country. What is government doing to stimulate them, to encourage them, to motivate them, to partner with them, to embrace them, and to say, yes, we are pursuing the same common agenda of making Nigeria healthy?
Building a strong primary healthcare system with a focus on rural communities, women and children's health were other suggestions brought to the fore.
Our health indices in Nigeria is so poor, about especially the maternal and child death rate, very poor. And so we are going on how we're going to manage saving a million Nigerian mothers and children between now and the year 2030.
Whenever you affect a woman, you affect the nation. And women are very, very special amongst us, you know. If you look at the ratio of population in Nigeria, we have more females than male. We have more women than men, and more children. You know, a lot of vulnerable diseases are under five mortality and everything.
With the worsening health indices occasioned by the COVID-19 pandemic, many had expected Nigerian leaders to learn from the past to reform the health sector.
A situation where you have the president of the country jetting out to take care of his health situation outside the country on the very day he knows that the doctors in his own country are going to stop working. So what is the message? Is that being fair? Very, very untidy, very inhuman to say the medical doctors working day and night are not being paid.
The need for tax reduction for private practitioners, increased budgetary allocation, COVID-19 vaccination and issues were brought to the fore.
Go and look at the budget of health sector in this country. When have we been able to hit even 5%? Yet you vote money to other areas that are unfounded. I was hearing in a few weeks ago how much they spent, about 85 billion naira, maintaining dead refineries without producing a single liter of petroleum. And then you see the way they are cutting money up and down. All you see today is using all our money to develop Niger Republic.
We don't have a functional health insurance system. The average Nigerian still pays out of pocket. I will say we are improving, but there's still a long way to go.
Let the government continue consciously to be educating people and make this vaccine, make it available to people, because before you know it, Nigeria, as what we are, they will begin to trade with it. A lot of people don't want to even go for the vaccine any longer. They just need to continue and consciously educate people about the importance of the vaccine, the side effects, initial side effects of the vaccine, and not the fact that after taking the vaccine, that doesn't mean you cannot still be affected. That after taking the vaccine, you open yourself to anything, any risk. No, you must still continue to be using every precautionary measures.
World Health Day is marked April 7th annually to highlight areas of concern in the global health system. The theme for the 2021 celebration is Building Fairer and Healthier World.
Tuberculosis remains one of the world's deadliest infectious killers. Each day, nearly 4,000 people die of tuberculosis, while close to 28,000 people fall ill with this preventable and curable disease. The World Health Organization, WHO, has also noted Nigeria as first in Africa with the burden of TB and sixth in the world.
Now, it's estimated that one case of tuberculosis can infect 15 people in a year. So when we have this staggering number of people missing cases in the communities, they continue to multiply the number of people infected with tuberculosis. So our drive as a nation is to get the new cases and use every mechanism to put them in treatment and retain the care so that at the appropriate time, based on science, these individuals are cured and they will reduce the transmission of tuberculosis in the country.
Transmitted through air droplets like flu, tuberculosis usually attacks the lungs and other parts of the body like the brain and spine. Being a major driver of HIV, the empowerment of the youths to redirect their energies from activities that can increase their chances of exposure was a major factor identified.
HIV and tuberculosis are like 5 and 6. Poor nutrition encourages tuberculosis. Poor housing with poor ventilation.
When you empower them, that will increase their livelihood and increase their income generations. And we all agree that an idle hands is the devil's workshop. So once they have what to do, definitely that will reduce their prone to HIV.
Once you have symptoms, do not joke with it. If you have cough, if you have fever, especially one that is lasting longer than usual, you need to get to the hospital to get to test. It is only by testing that we will get to identify those who have disease. And because HIV and TB go together, whenever we have somebody who have TB, we are closer to identifying somebody with HIV.
Lifestyle, everything that reduces your immune system will predispose you to having tuberculosis. So we are calling on everyone, the government, the private sector, the civil society, and gentlemen of the press, to help us to make sure that we kick off tuberculosis in the country.
The age group of 14 to 45 years, which constitutes the active workforce of a nation and mostly affected by tuberculosis and HIV infection.
It was a gathering of Labour women leaders in Lagos State, and their mission is to resist every form of violence against women at work, place, or anywhere.
A male can be, either male or female could be gender. Female could be the one that is being violated, male could be the one that is being violated. But what is the percentage of the male that is being violated against the percentage of females that are being violated? Females are always at the receiving end.
I want to tell the men, we are their mothers, we are their sisters, and without us they can do nothing, they can achieve nothing. All they need to do is to respect us and give us a chance. With this, I know we will work together as a team. We are not asking them to quit, but let them give us chance. And let us use our brain and the psychic power that Jehovah has given unto us to be able to run our homes and the extended family.
We say no to domestic violence, both in the workplace, at home, even in the markets. We are going to wage war against such acts now. We are out for them because we are going to sensitize the market women. We are going to sensitize our workers that when things happen, they will know the right place to go and how they should not keep quiet. It's because women have been keeping quiet that leave them. That was why the thing is now accustoming them. But we will never allow it again. We will fight it, and God will fight it for us.
They need to be protected. They need to be given chance to exploit themselves. So anybody with his right-thinking sense shouldn't raise up his hand and beat any woman.
Nigeria has long been facing a gender-based violence crisis, with over 30% of women and girls under age 15 to 49 having experienced sexual abuse at home or workplace.
Welcome back. Mr. and Mrs. Omage Ewale were delivered of 5 babies in January. They had waited for several years after marriage before the babies came. Some experts spoke with AIT on the issue and the urgent need for external assistance to keep the babies thriving. In the remote area of Egbeda in Alimosho local government area of Lagos State lives Mr. Omage Ewale, a civil servant on level 8 with the Rubber Research Institute of Nigeria, and his wife Foyeke Omage, and their 5 newborn babies, 2 boys, 3 girls.
Oh, the one at my back is a boy.
You see the way it's used. Yeah. Even this one is greeting you people.
That's my second name. All of them survived.
In fact, you can see the way they are healthy. When we take them to hospital, even the doctor will be telling us, what are you, how do you feel, what are you using? It's not just us, it's God.
Since their birth on the 18th of January 2021, it has been an Herculean task for the mother to breastfeed the babies, so she opted for supplementary feeding to support. In a week, they spend no less than 50,000 naira for baby food and diapers, a situation that has put their continued survival at the mercy of good-spirited Nigerians.
We have called governor of Lagos State governor, my governor, Edo State governor, Osun State governor, where my wife is from, federal government, federal head of service, non-governmental organizations, NGOs, corporate bodies, religious leaders, to come to our aid, to cope with their feeding. Now, coupled even with our house rentage is ending May. So it's not easy at all.
The journey to this new way of life for the Edo couple began in 2020 after waiting for 7 years in marriage to have their own children.
Last year, 2020, I was in Benin when my wife went to the hospital. She was told that she's pregnant. They now asked her to come the second week of it. So she went there. The doctor said they are seeing 4 babies in the scan. The 3rd week she went there, the doctor told her it's not even 4. They are seeing 5. The doctor has to even call the consultant to come and see by himself. And behold, they say it's 5. She still called me and told me, I say, I repeat the same thing, that with this economic hardship of this country, how are we going to cope to take care of them? No. On the 8th of last year, 2020, December, when she went to LASUT, because that is where she used to go, Lagos State University Teaching Hospital, she was told that they will not allow her to go. And that is the same day I left for Benin. She called me, I was still inside the vehicle going to Benin, that consultant want to speak with me. I said, okay. And I said, okay, no problem. They now said they will not allow her to go because the history of LASUT, since the LASUT was created, such number, they have not delivered attend to such number before. I say, this one, how we going to do it? Because coupled with the money they said they are paying there daily there. So they say you must stay, that she have to sign if she don't want to stay. that if anything eventually happen, it's not their fault. So since that on the 8th of December, she has been there. We have been spending here. We have to even go and borrow because the money involved is huge. She was there throughout the January 18, 2021. They did the CS and she delivered her baby safely.
At what month?
At 8 months, 33 weeks. 33 weeks plus. So she delivered the baby without no complication. We are thanking God to take care of them. It's not here. It's not only the baby this time. There are times we are 7 in number here that are taking care of them. As we speak now, they are taking 2 cans of Nan1 every day. Although some Nigerians are also helping us. We have called governor of Lagos State Governor, my governor, Edo State Governor, Osun State Governor, where my wife is from, federal government, federal head of service, non-governmental organization, NGOs, corporate bodies, religious leaders to come to our aid. Although we have not really seen some, but individuals have tried their best. So to cope with their feeding now, couple with our house rentage is ending May. So it's not easy at all. Passionate appeal to the Nigerians, to the federal government, to the state government, Lagos State Governor, my Edo State Governor, the Osun State Governor, where my wife is from, religious leaders, non-governmental organizations, corporate bodies to come to our aid for the upkeep of our babies.
In my curiosity, I probed further to know if the couple had the history of multiple births in their family.
Yes, we have twins in my family. Same thing with my husband's family.
Did you by any time pray for something like this, that God should give you plenty children?
We did it. We only pray for God to give us our children. We do not pray for multiple ones like this.
Not unusual. Just like the process where you have twins, it's the same process where you have triplets, quadruplets, and quintuplets. The only problem is that once these babies are delivered, they need to be properly looked after because they may not be old enough to withstand the rigor, so they need to be properly looked after by incubator care or supportive care for the first few weeks of life. But again, it's always good for people to embrace family planning. You go for proper medical antenatal care so that some of these things can be detected early so that they can prepare the woman early.
They need a lot of funding to take care of the children, to feed them, to make sure that they have everything that they require to grow very well, particularly feeding and then taking them to hospital for regular checkups. So that if there's any problem, it can quickly be nipped in the bud. I don't know if government can help them, if societies, if charity organizations can help them.
Multiple births, according to medical experts, is the culmination of one multiple pregnancy where a woman delivers 2 or more offsprings.
I don't have choice, but God help me and God strengthen me. Because if you even see me during that period, you don't know that I'm carrying such number. My doctors, they normally look around, they will look at me, they will say, this woman, you are strong. I say, it's not me, it's God. Because that has been my prayer point every day, that God, I need your divine strength to move on.
Survival of children from multiple births, people often say, is difficult. But the quintuplets of Mr. and Mrs. Omage Iwaile have so far survived 3 months and counting. On our nutrition segment, we preach the message of eating right to stay healthy. The focus today is on soya beans.
The soya bean is a species of legume native to East Asia, widely grown for its edible bean, which has numerous uses. Soybean, an important component of Asian diets, and have been consumed for thousands of years. Today, soya beans are mainly grown in Asia, South and North America. In Asia, soya beans are often eaten whole but heavily processed. Soya products are much more common in Western countries. Various soya products available include soya flour, soya protein, soya milk, soya sauce, and soya beans oil. Soya beans contain antioxidants linked to various health benefits. Soya beans are mainly composed of protein, good amounts of carbs and fats. Soya beans are among the best source of plant-based protein. Consumption of soya protein has been linked with a modest decrease in cholesterol level. Soya beans are a good source of various vitamins and minerals. Consumption of soya beans has been linked to reduced risk of cancer, alleviation of menopause symptoms.
On Health Affair, we'll give you a holistic approach to health education and information. So come with me to our clinic for tips on healthy living.
It's important for the cancer patients to encourage themselves within. Even when they get the diagnosis, most people when they get the diagnosis feel, oh, it's a death sentence, but it is not. So the theme, I am, yes, you're a cancer patient, but I will overcome is what is there. And we too, as their caregivers, are telling them that they will overcome.
On our perception segment, we give a voice to your opinion on the way forward for the nation's health sector.
Because of their failure in ensuring a qualitative healthcare services that is to be rendered to Nigeria. How are the leaders are supposed to provide qualitative healthcare services? We have the resources, but we don't have the equipment, we don't have the enabling environment for them to be able to perform at the ultimate level. And that is why you see our leaders, they leave the shores of this country to go abroad to source for quality healthcare services, which is very, very wrong. Which is wrong. They're supposed to improve on what we have in this country. They're supposed to bring the expertise and what they have seen and what they always see in abroad back to Nigeria. They need to improve on the facilities. They need to improve on every aspect to turn around the health sector, you know, for those in the health sector to be able to render quality services at all times.
Welcome to our Know Your Instrument segment, an aspect of the show that focuses on first aid and the benefits of different medical instruments.
A bandage is a piece of material used either to support a medical device, such as a dressing, or on its own to provide support to restrict the movement of a part of the body. When used with a dressing, the dressing is applied directly on a wound and a bandage used to hold the dressing in place. Other bandages are used without dressing, such as elastic bandages that are used to reduce swelling or provide support to a sprained ankle. Tight bandages can be used to slow blood flow to an extremity, such as when a leg or arm is bleeding heavily. Bandages are available in a wide range of forms, from generic cloth strips to specialized shaped bandage designed for a specific limb or part of the body. Bandages can often be improvised as the situation demands, using clothing, blankets, or other materials. Different types of bandage include adhesive bandage, compression bandage, short stretch compression bandage, long stretch compression bandage, triangular bandage, and tube bandage.
This is where we wrap up the show today. Please join us same time next week for another exciting edition of the program. I remain your host, Ushomowa Daniels. Remember that your health is the greatest asset you require to achieve all other things. Please pay attention to it.